Cupping therapy, the ancient practice embraced by U.S. Olympic athletes by BuzzFeed.com. Here's what you should know about the ancient practice embraced by U.S. Olympic athletes. This week everyone's talking about cupping, a therapy that some Olympic athletes competing in Rio have been partaking of. It caught people's attention this week because the therapy often leaves round marks that look like bruises on the skin, but it's certainly not new. The practice has been used in ancient Chinese medicine for thousands of years as a way to treat pain, muscle stiffness, and even respiratory issues. Perhaps one of the most notable athletes to sport the signature cupping marks is Michael Phelps. Other athletes, including swimmer Natalie Coughlin, have also embraced the practice, as you can see below. That's been the secret that I have had through this year that keeps me healthy, said American gymnast Alexander Nadur, USA Today reports. It's been better than any money I've spent on anything else. So how does cupping work? Either heat or air is used to create a suction in special cups that are placed on the body. The vacuum that's created pulls the skin and blood vessels in toward the cup, which is why they can leave marks on the skin. Cupping is thought to pull blood to a certain area, and improve circulation and loosen up muscles and joints. There's also some suggestion that it has anti-inflammatory effects. In the US it is sometimes used in addition to acupuncture or massage. A specialist could apply the cups, though as USA Today reports, some athletes say they are doing it themselves. There is a difference between how cupping is practiced in traditional Chinese medicine and how it is used in Western medicine, says Dr. Brent Bauer, director of the Mayo Clinic Complementary and Integrative Medicine Program. Bauer says a traditional Chinese medicine practitioner would likely offer cupping as part of a larger integrative health check, which might include recommendations around nutrition and other health things, and not just as a one-off therapy. It's kind of an American phenomena, I think, to consider cupping by itself, he says. In traditional Chinese medicine, the theory is that cupping can influence the flow of energy or qi through the body, says Bauer. If someone's flow is blocked or stagnant, a practitioner might use cupping to impact the flow. Western practitioners may focus more on what the therapy might be doing to muscles or blood flow. Some question whether there's enough clinical evidence to say cupping is definitely effective, though it has been studied. A 2010 review of 550 clinical studies, including 73 randomized controlled trials which are considered the gold standard study in the science community, concluded that the majority of studies show potential benefit on pain conditions, herpes zoster, and other diseases. None of the studies reported serious bad health outcomes from the practice. Another 2014 review of 16 studies with 921 people reported short-term pain reduction from cupping. I think you have to step back and say, if this has been part of an organized medical system for 3,000 to 5,000 years, we probably shouldn't be too quick or too arrogant to dismiss it out of hand as Western scientists sometimes do, says Bauer. On the other hand, just because something has been around for that long doesn't mean we should embrace it willy-nilly. You are watching Cupping Therapy, the ancient practice embraced by U.S. Olympic athletes by BuzzFeed.com. Please like, share and subscribe our channel for more daily videos. Thank you for watching. Six amazing health benefits of eating a banana every day by BuzzFeed.com. Bananas might be the perfect fruit. They've got a built-in protective covering with a convenient tab for removal. Their color instantly tells you when they're ripe. They've got a delicious taste that nearly everyone enjoys. And perhaps most important, they're packed with beneficial nutrients. No wonder bananas are Americans' favorite fruit. The average American consumes over 10 pounds of bananas annually. Whether you're already a banana lover or someone who needs more reasons to up his or her fruit intake, here are 6 big benefits of regularly eating bananas. 1. Bananas help you breathe easier. Nearly 26 million Americans suffer from asthma, and it's the leading chronic disease among children. But preventing asthma could be as simple as eating a banana a day. A study at the Imperial College of London found that children who ate at least 1 banana a day experienced 34% less wheezing than those who ate less than 1 banana a month. If you're looking to prevent asthma-related symptoms and breathe better, reach for a banana. 2 bananas help control blood sugar. High blood pressure is a silent killer. Its effects include aneurysms, narrowing of the arteries, heart disease, brain disease, stroke, and kidney failure. One way to lower your blood pressure is to consume more potassium, a nutrient abundantly found in bananas. One average-sized banana contains about 12% of your daily value of potassium. A 2005 study conducted at St. George's Medical School found that potassium citrate, the type of potassium found in bananas, is effective for lowering blood pressure. In the span of only a couple of weeks, participants with high blood pressure who consumed potassium citrate daily lowered their blood pressure significantly. The Harvard School of Public Health recommends eating foods high in potassium citrate to help you control your blood pressure. 3 bananas assist with appetite control. Bananas are a great source of fiber. An average-sized banana serves up 12% of your daily value. A diet high in fiber has numerous benefits. According to the Mayo Clinic, it helps to normalize bowel movements, lower cholesterol levels, control blood sugar, maintain bowel health, and aid in achieving a healthy weight. The Harvard School of Public Health states that fiber appears to reduce the risk of heart disease, diabetes, and cardiovascular disease. One of the most interesting effects of fiber is that it slows down digestion, which helps you feel fuller longer after you eat. This can be a great benefit for people who want to cut calories and lose weight, or for anyone looking for an afternoon snack to hold them over until dinner. 4 bananas can help ward off cancer. According to the American Institute for Cancer Research, dietary fiber convincingly lowers the risk of colorectal cancer, and vitamin C, of which a banana supplies about 17% of your daily value, probably lowers the risk of esophageal cancer. Fruits in general probably lower the risk of lung, stomach, mouth, pharynx, larynx, and esophagus cancer, according to the Institute. You are listening 6 Amazing Health Benefits of Eating a Banana Every Day by LifeBuzzFeed.com. 5. A banana is essentially a sports drink in fruit form. If you're looking for the perfect pre- or mid-workout snack, bananas fill the bill. A study conducted at Appalachian State University found that eating bananas during a long workout helped fuel performance as well as sports drinks. This type of research shows that you can have healthier carbohydrate sources before and after exercise that will support athletic performance just as well as a sports drink, said Dr. David C. Neiman, one of the study's lead authors. The simple carbs available in bananas can be converted quickly into energy, and the fact that they're high in potassium, an electrolyte, can help prevent dehydration. Bananas also have several nutrients, such as antioxidants, fiber, and vitamin B6, that aren't typically found in sports drinks. 6. Bananas build stronger bones. Their high potassium content makes bananas a great food for anyone looking to build stronger, healthier bones. According to the University of Maryland Medical Center, increasing the consumption of potassium-rich foods can help prevent osteoporosis, and a 2008 study found that a diet high in potassium-rich, bicarbonate-rich foods significantly reduces bone turnover, another term for bone loss. Bananas also contain 16% of your daily value of manganese, a nutrient that might help prevent arthritis and osteoporosis. Botox can treat urinary incontinence problems, FDA approved. By LifeBuzzFeed.com. It's FDA approved to treat urinary incontinence. For women suffering from loss of bladder control, an injection of botulinum toxin type A, best known by the brand name Botox, can bring some much-needed relief, according to a new study. Botox is well recognized as a popular way to temporarily get rid of wrinkles. However, the drug has approval for 9 medical conditions including chronic migraines, excessive underarm sweating, eyelid spasms, and more. Botox is approved for use in the U.S. for urinary incontinence, which affects between 3% and 17% of women over age 45 and 3% to 11% of men. In a new study published in the journal JAMA, Researchers compared Botox to an implant called Interstin, which can also treat the health condition. Overall, the researchers found Botox provided more day-to-day relief. In the study, Dr. Cindy Slimane of Duke University School of Medicine and her colleagues looked at 381 women who had at least 6 loss of bladder control episodes over 3 consecutive days, and were not responding well to other treatments, like dietary changes, medication, or pelvic floor exercises. The women were randomly assigned to get a Botox injection or the implant. After a short trial period to see if the women responded to their treatment, 364 of the women were followed for an additional 6 months and were asked to keep a log of any incontinence issues. The results were pretty similar between the two therapies. The women who received Botox lowered their number of incontinent episodes by March 9th on average, and the women with the implant lowered their number by March 3rd. The women who got Botox were more likely to report being satisfied with the treatment. The take-home point is that both treatments are good treatments, says Slimane. Both therapies are effective at relaxing the overactive bladder muscle, but they do so by different mechanisms. Though Botox appeared to work ever so slightly better than the implant, it was also associated with a higher risk for urinary tract infections. Currently, more insurance plans do not cover Botox or Interstin unless a person has exhausted other options. Botox is approved for use on bladder incontinence in men and women. You are watching Botox can treat urinary incontinence problems, FDA approved. By lifebuzzfeed.com. Please like, share and subscribe our channel for more daily videos. Thank you for watching.